I'm Dr. Kamran Goudarzi, or some people call me Dr. Kamran. That's basically my first name. I'm a general vascular surgeon. I've finished medical school in 1978, and I've basically been in practice for quite a few years. I received my MD degree from University of London in England. I did 2 years of postgraduate training in England in general surgery. Then when I came to the United States, I started all over again with general surgery. I spent another 5 years, and I'm board certified from the American College of Surgeons here in the United States. I'm also board certified in phlebology. Phlebology is the science of venous disease or diseases of the veins. I believe my certificate number was like 150 or 140, so I was one of the first, at least 150 to 200 surgeons in whole United States to get board certified in phlebology. I'm a clinical professor from the University of North Carolina in Chapel Hill, and I'm a fellow of American College of Surgeons and fellow of International College of Surgeons. Varicose veins are ropey, large veins that one can see underneath the skin. I'm sure most people have seen people in the street with these large veins that look like little snakes sticking out underneath the skin. Now, there are two types of veins. There are the deep veins, and there are the superficial veins. Superficial veins are the veins which are right underneath the skin. You're all familiar with superficial veins. When you go to have your blood drawn, they're drawing the blood from your superficial vein. And when they inject it or put a needle in it, the chances are that particular vein is going to go. You'll have another one in its place. So the superficial veins are not important. They are part of the venous system. So blood gets to the leg through the arteries. It gets out through the veins. The pressure which pushes the blood into your leg is from your heart. When your heart pumps, it creates a pressure of 120, 130, 140. We've all heard about blood pressure. That's what blood pressure is, the amount of pressure the heart exerts on the artery. Pushes the blood down to your leg. So that blood at your foot, at your ankle, or at the tissue, the only way it's going to get back to your heart, there's not another heart in your foot. The blood has got to get back out through the vein. And the way it gets out is through your muscles in your leg, particularly your calf muscles. So when the calf muscles contract, just like a pump, it pushes the blood out. And when they relax, there are valves inside the vein which stops the blood from falling back down. Arteries don't have valves because they don't have to. The heart is pumping the blood out. Veins need valves. Now, if these valves fail, the blood does get pushed up, but when the muscle relaxes, the blood comes right back out, backwards. So essentially, you have no flow in these veins. Blood is going up and then falling back down. It is not moving. It's just going up and down. That's all it's doing. So when you have large varicose veins, at the end of the day, when you look at your leg, and your leg has all these veins engorged with blood, that is the blood which is not circulating. It is sitting in your leg. So if we destroy those veins, if we get rid of these bad veins, then the blood can get back through the deep system, back into your heart. And that is one of the reasons I believe when I treat patients with venous disease, they tell me their leg is not as tired, they can walk further, they can do more. And I bet you that the heart probably doesn't have to work as hard either because blood is getting back into the heart so it can get pumped out. Remember, heart is just a pump. What comes in gets pumped out. We all know you don't want to run your pump dry. You don't want your pump to be empty. You want it to be full. You want to make maximum of your circulation, of your blood volume. And that is why venous disease is so important, and I don't think they have paid all the attention that we could have in the study and treatment of venous disease. We at the Scarless Vein Care provide free consultation for the simple reason that venous disease is a very commonly undiagnosed or underdiagnosed condition. And the bottom line is, I feel by providing them with a free consultation, it alleviates anxiety, allows them to come in and see us and ask their questions. Now, during that visit, it gives me an opportunity to make a diagnosis if indeed that is what's bothering them. So if they do not have venous disease, they go and see some other physician who could help them. And if they do have venous disease and they decide to come back to see us, of course, I'm always very glad to see them. Spider veins are usually cosmetic. They look ugly. They don't look good, but not necessarily. I've had patients who complain of pain around the spider veins. They literally sting or they hurt. And there are some spiders which have no symptoms at all. There are others which hurt. I guess if they're close to a nerve, a skin nerve, they would hurt. Brainwave is a very interesting technology. Basically, we utilize microwave technology in order to treat very small spiders and superficial veins. The thing which is very exciting about it is that you can have vein wave treatment and go right in the sun. You do not have to avoid sun. When you have laser treatment, usually you have to avoid the sun before and after. So it is definitely very good about that. It also allows us to treat very, very small spiders. Some of these spiders are so small that they cannot be injected. They are not amenable to sclerotherapy. Vein wave works particularly well on the face, on the small spiders, or what we call telangiectasia. These are very tiny veins on the nose and around the face. What sclerotherapy is essentially destroying small spider veins. You're trying to get rid of these spider veins because they're unsightly. Patients don't like to look at them. And the way we do them, we inject medication into the vein, which will destroy the vein. USGS stands for ultrasound guided sclerotherapy. We've already talked about the sclerotherapy. With USGS, you go one step further. There are veins that you cannot see. They're deep. They're feeder veins to those tiny spiders. And the way we treat them, we look at them with an ultrasound, and then we inject right into the feeder under the guidance of ultrasound. Laser ablation is essentially replaced what we used to do in the old days, which was venous stripping. And I personally, again, it's my own personal opinion, believe that venous stripping should essentially be obsolete. Now, the way we are enabling ourselves from not doing venous stripping is to do laser ablation. We just put a small laser. These laser filaments are very tiny now. They're just a few millimeters. We put them inside the vein. So instead of ripping and tearing and pulling veins, we just destroy the vein from inside out. And because you're not doing any cutting, because there is no cuts, there's no stitches, etc., you can do it in the office and the local. And that has really revolutionized the art of venous treatment or treatment of varicose veins.